When children are vaccinated, their immune systems produce antibodies that protect them from debilitating and potentially deadly childhood infections such as polio, measles, and diphtheria. The protection is supposed to last a lifetime. But scientists say the effectiveness of these vaccines is severely reduced when children are exposed to high levels of PFCs.
This was quite serious because we could also see that some of the children were so low in antibody concentrations that they were essentially not protected. So they had been vaccinated 4 times, and the vaccines had not worked.
Dr. Philippe Grandjean led a team of scientists in a study of children living on the Faroe Islands between Scotland and Iceland. The scientists followed a group of more than 500 children who had been vaccinated against diphtheria and tetanus. But children who showed elevated levels of PFCs in their blood also had very low concentrations of antibodies against these infections.
So it was quite a striking effect, one that I would not have anticipated.
Dr. Peter Hortes spoke to VOA via Skype. He is president of the Sabin Vaccine Institute, which promotes vaccine development and delivery around the world. Dr. Hortes says if PFCs do in fact interfere with antibodies and immune system functions, then the public health problem is going to be much worse in the urban slums of low and middle income countries where exposure to these industrial chemicals can be much higher.
Even a modest reduction in vaccine coverage and vaccine immune responses could lead to subsequent outbreaks of childhood diseases, that there's a risk that we could see recurrences of childhood killers such as diphtheria or pertussis or other childhood diseases now become more common in the world's poorest countries.
Scientists say PFCs are stable and persistent chemicals that have been in wide use for decades, so much so that everyone probably has detectable levels of compounds in their body. Dr. Philippe Grandjean.
We have not done enough in regard to protecting the population against these old compounds, and now we're stuck because we all have them in our bodies.
Critics note that since the study was done on island residents eating a mostly fish diet, it should have taken into account polyunsaturated fatty acids, which are found in fish and may suppress the immune system. Researchers say there is an urgent need to study the adverse health effects of perfluorinated compounds on larger populations. Vidushi Sinha, VOA News, Washington.